By the end of 2023, the remote patient monitoring market is expected to earn more than $31.3 billion. That is up from $15.8 billion in 2017. That's a 97% increase. I'd say that calls for a killer keynote. And the end of our day one. Welcome, Jackie Finn from Cambridge Consultants. Thank you.
Thank you. Hello, everybody. Thank you for sticking it out to the end. I appreciate it. I'm going to spend about 15 minutes or so, hopefully trying to demonstrate to you the marriage of science, technology, and engineering, and how it's moving forward to allow us to monitor patients and people in very different ways than we're doing now. What I want to do today is demonstrate it very much in a hospital setting. I want to talk about non-contact monitoring and how it can kind of really revolutionize, transform, and disrupt the kind of routine methodology that we have now in place for patient monitoring. And hopefully I just want to be able to, through the talk and through the video that I'm going to show you, inspire you and give you some food for thought as to how this type of technology could be used in your own industries. Okay, so at the moment, the World Health Organization estimates that by 2050, there's going to be over 2 billion people globally who are over 60. And 80% of those people are going to be in low to middle income countries where it's worth noting that there's not a great infrastructure or resource or money to deliver some high quality healthcare. Now, elderly patients tend to have healthcare issues with associated healthcare costs. So as our elderly population increases over time, it's a fair bet that the healthcare costs are going to increase as well. But if everybody is quite rightly demanding good quality healthcare, which they should, and everybody has a right to it, then you can throw money at the situation, but that's not the only thing that needs to give here. We need to have more resource thrown at the situation as well. And in the next decade alone, the United Nations, they estimate we're going to have to increase our workforce by 55%, which is 18 million additional healthcare workers, which is kind of a staggering amount. And if I put it into context, once a physician finishes grad school or med school, it probably takes them another decade to train in their chosen field and be truly impactful. So if we do the maths, it's simply not possible for us to hire this 18 million healthcare professionals, nurses, surgeons, clinicians, et cetera, in the next decade. So we need to kind of box clever and think about how we're going to deliver this healthcare in a different way. So that's why I'm focusing on technology today, because technology allows us to have an asynchronous relationship between one healthcare provider and many patients. And technology empowers our healthcare providers to look after people in a far more logistically friendly and flexible way, using services like telemedicine, chatbots, and remote patient monitoring and wearables. And it's that last thing, the remote patient monitoring, that I'm going to focus the talk on today. What I'm going to do is show you a technology project that our teams did over the summer. And to bring it to life, I'm going to kind of embed it in a real-world example. So I'm going to talk about how non-contact sensing can be used in the hospitals of the future to, as I say, disrupt the way that we routinely monitor patients on wards. And I'm going to embed it in the story of sepsis. So sepsis can kill anybody and affect anybody, all ages, all levels of health, equal opportunity killer. What is it? It's an acute illness or a condition, and it occurs when the body's immune system overreacts to any infection. It can lead to tissue damage, organ failure, and death. Now, when I was doing some research, I started off doing a UK-centric research, and then I broadened it out to the United States because I knew I was going to talk here. And I was staggered to find that over 1.7 million people a year can develop sepsis, and over 270,000 1,000 of those people die each year, which is 1 death every 2 minutes from sepsis. It's the #1 cost in hospitalization, so it ranks #1 in Medicare, #2 in Medicaid, #4 for the insured, and #1 again for the uninsured. An eye-watering $27 billion spent here in the States in 2017 on sepsis. Now, early detection of sepsis is absolutely vital if we're going to make sure that somebody comes out the other end and has a good quality of life. Sepsis can kill in 12 hours from the start of an infection, and it occurs and is responsible for 1 in every 3 hospital deaths. Now, if somebody presents in hospital with sepsis, it's fine. You get a sepsis care pathway. That's the regime. And you may die, you may not, but at least you're being treated for sepsis when you come into hospital. But many, many people come into hospital presenting with something completely different. And those people are particularly vulnerable because if we don't find out that those patients are deteriorating in hospital and understand that it's not just from the medication regime that we have them on for their presenting condition, then every hour of delayed antibiotic treatments for sepsis increases their mortality by 10%. So early detection is absolutely vital. What do we do today to monitor patients on wards? So there is a system called the early warning system. It's a track and trigger system. And essentially it looks at how ill a patient is whilst they're spending their time in their hospital bed. And so what happens in the early warning system is 6 simple parameters are measured, usually every morning and evening by your nurses. They'll come along and they'll use blood pressure cuffs and temperature thermometers, pulse oximeters, etc. And they'll take these 6 parameters. And then they'll give each one a score. And the magnitude of the score indicates how much that parameter deviates from the norm. So you take all the scores, you add them up, you aggregate them and get a single score. If somebody gets a score of 5, that's an alert immediately that that person may have sepsis. And at that point, people trigger the sepsis care pathway and start to look at bloods and urine analysis to make sure that sepsis is or isn't present and then treat accordingly. Now, in the UK, we have a national early warning system called NEWS. And the Royal College of Physicians state that that should be done every 12 hours, so usually a morning and an evening. In the United States, there's no one standard here, probably due to the size of the country, but it's pretty much a variation on this theme, including all these 6 parameters. So we've mentioned it's a time-critical condition. We've mentioned that the early warning signals tend to be taken every 12 hours, but sepsis can kill in that time frame. So monitoring in this episodic way is not ideal. And what we really want to do is monitor continuously. And what we really love to do is to be able to monitor in a non-contact way. So there's no impact on the patient, there's no impact on the staff. They can get about treating their patients as opposed to constantly monitoring that they've got the right electrodes and sensors and patches and they're hooked up to the right systems, etc. So what I want to do today is to show you a short video that we've done. It's silent, so I'm going to voice over it as it goes along. And what the challenge this year we set the team was to see how many of those early warning signals we could measure in a non-contact way using various different types of technologies. So we did this project in about 2 to 3 months. And what I want you to see is that we've managed to achieve, I feel, quite a lot in those couple of months. And what I want to show you is what this kind of technology could look like in a hospital of the future after this, and then maybe future gaze even more to how we could apply this in other settings. So this is a volunteer sitting in front of our rig with our user interface showing in real time the signals coming. And we had 3 different types of cameras, a machine vision, a thermal imaging, and a time of flight sensor, measuring 4 different parameters. So we start with skin temperature. The thermal camera was able to take, with facial tracking algorithms, an area of interest at the forehead, and the infrared feed took the hottest part of that forehead for the skin temperature. The machine vision camera also has facial tracking algorithms, and for heart rate, we took volumetric flushing of the skin. we took the signal from the color camera and we broke it down into its independent components of red, green, and blue. And the subtle color changes each time the blood pulsed through the skin allowed us to reveal a heart rate pulse. We used blinking as a proxy for consciousness. And again, those same facial tracking algorithms combined with high-definition video allowed us to determine if the eyes were open or shut. And then finally, we used a depth sensing camera. And again, the infrared zoned in on the region of interest of the chest and was able to see the rise and fall of the chest to indicate respiration. So what we're able to do is take machine learning and sensor fusion algorithms to determine parameters and get facial tracking algorithms to decide where to find those parameters. So here you see in real time our volunteer in the top left-hand corner with a toggle between the depth sensor and the thermal camera at the bottom, showing 4 different inputs coming out live. You can see his blinking. He starts to blink quite a lot as we start to talk to him. Now, these are our volunteers that we gathered our data to make this data gathering exercise as robust as possible. And we chose them for specific reasons, because we wanted to iron out wrinkles in data acquisition. So one of the things we wanted to do is to make sure that we could cover as many different skin tones as possible. So there is a skin tone classification system, you're probably all aware of it, called the Fitzpatrick scale. Scale 1 being the palest, 6 being the darkest of skin. And so what we wanted to do was see how robust our data would be. And we were able to gather from Fitzpatrick 1 to 4 in a very robust, reliable fashion. Fitzpatrick 5 introduced some noise into the data. And Fitzpatrick 6 we were able to take from the palm of the hand. We also wanted to see whether the presence or absence of glasses would allow us to still pick up blinking, which was fine. We also wanted to see whether or not dark clothing would still allow us to get respiration, and that was also fine. And we also wanted to see whether the presence of a fringe on the forehead allowed us to still pick up heart rate, and again, that was fine. So what I want to do now is imagine the hospital of the future, given what you've seen. We've put a couple of mocked up examples of a dashboard in a hospital together, just to kind of inspire you, to give you an idea of where we could be. So imagine that above each patient's bed, there is a rig. And that rig, maybe it's above or below their TV screen that they're looking at. And that rig contains all of the technology to allow us to get all of those early warning system parameters. And we're, as continuously as possible, monitoring those patients and using AI to constantly update their early warning scores and present that on a dashboard. So here, let me see, there we go. So here you would have the nurse's station, and this is where this dashboard would sit, so anyone can have a look at it. And what I've done is represented Queen Elizabeth Hospital here in the UK. There are 4 floors. You could toggle between all 4 floors. This is showing one of them and showing the exact position of each bed that's being occupied. And it's also pushing through all of the early warning signals system outputs at that time and color coding them. So anybody who's unfortunate to have reached a score of 5 at that particular moment alerts. And you can see that this individual here, Roger Fennick, you can immediately get an alert and see what the next course of action is. And in this case, you have to look for sepsis. So immediate course of action, bloods and urine analysis. What's helpful about this longitudinal data is it's rich and contextual, and it allows you to see if somebody's trending towards or away from a 5. So it's just as important to see the scores, the different color codings of the yellow and the amber, because you still need to pay attention quite carefully to those people, particularly those that are deteriorating, as opposed to kind of getting better or trending away from the 5. So this kind of population view allows you to manage by exception. And remember, we've got some precious healthcare resource, and we need to kind of utilize their expertise as cleverly as possible. So this type of real-time data allows us to put the right people to the right patients at the right time when they need urgent clinical attention. And you've got various different other manifestations of the data. So for example, We can see beside somebody's bedside all of the early warning signals here. Again, nicely color-coded. That would be going along in real time with the early warning score down the bottom. And if anybody was doing their ward rounds, they would be able to drill down into that person and get the clinical insights to start to understand what's actually going on with that individual. Because certain elevations or decreases in vital signs are indicative of certain different diseases. So this is a really great way to present all of that data in various different levels of granularity. But what about the future? There's a lot of challenges, and I'll talk about those in a minute. But imagine this type of thing looking after the health and well-being of all of us in real-world settings such as air traffic control. ATC is an incredibly stressful job. They have 8-hour shifts and can only work for 30 minutes to 2 hours at a time because they have to be completely concentrated. And obviously, so many of us have flown in here, we want them to be completely concentrated, right? And so you can imagine this kind of thing being able to look for stress and fatigue and various other signs. You can imagine it for long-distance truck drivers. You can imagine it for people in the home, babies in a crib, people in hospital, as I've said, construction workers. This type of technology has great far-reaching consequences for looking after the health and well-being of all of us moving forward. Now, there are challenges, for sure. We need to ensure that this type of data acquisition is as robust as possible in as many different situations as possible. In our short trial, people had to sit fairly still. So we would need to make sure that it was a bit more robust so that you didn't have to be completely, very, very still all the time, and it could cope with different use cases, different ethnicities. Data privacy is absolutely key, and facial recognition to make sure that you're measuring the right people, and if somebody's got into the wrong hospital bed, you're not kind of alerting unnecessarily on somebody who's completely different. So all of those things are there for the taking. They're things that we can absolutely address, and the holy grail, to be honest, in all of this is blood pressure. Trying to get a contactless way to do blood pressure is something that lots of groups are actively working on, ourselves included. And I think when we crack all of these, it's going to be a really, really exciting time for contactless monitoring, because if you look at all of the wearables, I think there's something like 650 wearables here at CES this year. There's only so many wearables a person can wear, right? So we're going to get to a point where people are just not going to comply, because you're going to have so many things on you, and you're going to have to make sure they're connected to a phone, and then make sure that they're all, juiced up, and it's just going to be really difficult to kind of sustain that level of innovation in actual physical form factors. So this type of thing really takes us into a new era, I think, for monitoring. So with that, I'd like to say thank you so much for your attention. Really, really enjoy the evening ahead of you, and come and visit us at the booth. Thank you.
Fantastic.
Thank you.